We're going over complex motions for the upper extremity and lower extremity, and then actually combining them, and then combining them in countersink. And so for the upper extremity, what we got to think is the functional neurologist will tell you what joints we specifically want to focus on. But just to give you guys an idea, the more joints we move, the more activation it is to the brain. So some people can move every joint and they'll be okay, but some people might get sick, nauseous, have their symptoms return if they move too many joints. So to give you an idea, we usually start with like a shoulder. It's a simpler joint. It's not as complex as all of these little guys, right? So just for doing a complex motion with my left arm, and we're going to focus on the shoulder, we just can kind of go like this. And the complex motion that I typically go with is an infinity sign. And just to keep it, if we want to keep it at its simplest level, we're just going to keep the hand still and make that infinity sign. Then if we want to up it a little bit more, and the reason why I'm telling you this is if you feel that you're doing well, there's going to be these little tidbits that you can keep on elevating and making the practice a little bit more difficult. Then what we can do is we can start to move our hand up and down, and then we're going to get another motion out of that shoulder joint, which is going to activate the brain a little bit more. So then we can move that hand up and down. Then if we want to work just the elbow, sometimes that's where a person can tolerate things better, we can do our infinity signs like this. Same concept. If we want to just keep the hand in one plane, we can do that. And then we want to make it a little more complex, we can turn the hand up and down. Then we also have our wrist that we can do the complex with. We typically use that when we're combining with the other one. It's kind of hard just to move the wrist, but still at times it may be what's necessary. And then there's even times when you want to do a finger, depending on each patient. Now I want to show you how to kind of combine a few. Now when a person's doing really well and they need to get more activation into it, we can do multiple joints at once. So if you see now, I got my shoulder, my elbow, and I can even get my wrist all engaged into this complex motion. So we're going to go and do the infinity like this. So I'm moving my wrist, my elbow, and shoulder all through these motions to get more brain activation. We're going to continue with going over some complex motions, and now what we're doing is we first went over the upper extremity. We're going to show you how to do the lower extremity, and then we're going to show how to combine them both after that. With the lower extremity, a little more simpler. We don't have as much diversity through the joints. So for the hip, we can literally just kind of keep the whole leg straight and make an infinity sign. As you get a little bit better, you can start to move your foot with the infinity sign. Then, as we keep progressing from there, you can bend the knee, and we can kind of move the foot and the knee for that complex motion. And that's going to be the most dynamic complex motion that you're going to get out of the lower extremity.